Recording.
Start? Should we start?
Yeah.
Okay, well, good afternoon, everyone. Welcome to our LAMP lecture series featuring the five elements. It was interesting video beforehand, and then it's something that we could actually share and review. As I was just browsing through stuff about the five elements, water, earth, fire, wood, and metal, it actually was derived from Wu Xing, which means Wu as the five and Xing meaning moving. So it's been used in many traditional Chinese fields to explain phenomena, including cosmic cycles, interaction between internal organs, and succession of political regimen. So it has been used since the first century during the Han Dynasty. So later on, this was translated in English as the five elements. This translation is still in common use as practitioners of TCM. You can find this anywhere from music to astrology to feng shui, martial arts, military strategy. So this is very important. So I will share that information with you in the chat. If you have any questions, I will be monitoring the chat room, and there will be a question and answer portion after the presentation. So I will give this to Dr. Hector de la Cruz.
Thank you very much. Okay, I think let's get started. We would like you to be acquainted with the pathology in the five elements. Thank you very much. Hello everyone, welcome to another topic for the LAMP lecture series. This time we discuss the five elements in pathology. The five-element model provides an important and clinically useful pattern of pathological relationships among the internal organs. In the five-element relationships, only two of the possible sequences apply to pathological cases. These are the overacting and insulting sequences. The generating sequence can also give rise to pathological conditions when it is out of balance. The essence of the five-element relationships is balance. The generating and controlling sequences keep a dynamic balance among the elements. When this balance is upset for a prolonged period of time, disease ensues. This occurs when the controlling relationship among the elements gets out of control and becomes excessive. Similar to the physiological relationships, the overacting sequence relationships can be explained in terms of internal organ pathology. If liver qi stagnates, it invades both the stomach, impairing its function of rotting and ripening, and the spleen, impairing its function of transforming and transporting. In particular, when liver qi invades the stomach, it prevents stomach qi from descending, which causes nausea, and it prevents spleen qi from ascending, which causes diarrhea. The heart overacts on the lungs, and heart fire can dry up the lung fluids and cause lung yin deficiency. Key characteristic symptoms of lung yin deficiency are the dry cough, weak, hoarse voice, dry throat, and night sweating. The spleen overacts on the kidneys. When the spleen holds dampness, this can obstruct the kidney function of transformation and excretion of fluids. The lungs overact on the liver. If lung qi fails to descend, it may impair the physiological rise of liver qi. Also, lung heat or phlegm heat may be transmitted to the liver. The kidneys overact on the heart. If the kidneys fluids accumulate pathologically, they impair the function of the heart, a pattern called water overflowing to the heart. These relationships along the insulting sequence also appear in pathological conditions. The liver insults the lungs. Liver qi can stagnate upwards and obstruct the chest and breathing. Liver fire may also obstruct the descending of lung qi and cause asthma. The heart insults the kidneys. Heart fire can infuse downwards to the kidneys and cause kidney yin deficiency. Key characteristic symptoms of kidney yin deficiency are the sweating and back pain. The spleen insults the liver. If the spleen retains dampness, this can overflow and impair the free flow of liver qi. The lungs insult the heart. If the lungs are obstructed by phlegm, they can impair the circulation of heart qi. The kidneys insult the spleen. If the kidneys fail to transform fluids, the spleen will suffer and become obstructed by dampness. The generating sequence can also give rise to pathological states when out of balance. There are two possibilities. The mother element is not nourishing the child element. The child element is taking too much from the mother element. The liver or mother affecting the heart, the child, this happens when the liver fails to nourish the heart. It corresponds to the internal organ pattern of deficient gallbladder. Specifically, when liver blood is deficient, it often affects heart blood, which becomes deficient, and palpitations and insomnia ensue. Another particular way in which wood affects fire is in the effect of the gallbladder on the heart. This happens on a psychological level. The gallbladder controls the capacity of making decisions, not so much in the sense of being able to distinguish and evaluate what is right and what is wrong, but in the sense of having the courage to act on a decision. Thus, it is said in Chinese medicine that a strong gallbladder makes one courageous. This psychological trait of the gallbladder influences the heart, as the mind, which is housed in the heart, needs the support of decisiveness and courage given by a strong gallbladder. In this way, a deficient gallbladder can affect the mind of the heart, causing emotional weakness, timidity, and lack of assertion. The heart, the child, affecting the liver, which is the mother. If heart blood is deficient, it can lead to general deficiency of blood, which will affect the liver storage of blood. This causes scanty periods or amenorrhea. The heart, the mother, affecting the spleen, the child. The mind of the heart needs to support the mental faculties and capacity of concentration, which belong to the spleen. Another aspect of this relationship is in heart fire deficient being unable to warm spleen yang, and leading to cold feeling and diarrhea. Ultimately, however, the physiological fire of the heart is itself derived from kidney yang. Describes spleen yang deficiency due to failure of physiological fire of the body in providing heat to the spleen to transform and transport. The spleen, the child, affecting the heart, the mother. The spleen makes qi and blood, and the heart needs a strong supply of blood. If the spleen does not make enough blood, the heart will suffer, and palpitations, insomnia, poor memory, and slight depression will ensue. The spleen, the mother, affecting the lungs, the child. If the spleen's function of transformation and transportation of fluids is impaired, phlegm will be formed. Phlegm often settles in the lungs and causes breathlessness and asthma. The lungs, the child, affecting the spleen, the mother. The lungs govern qi, and if lung qi is deficient, spleen qi will be affected, causing tiredness, no appetite, and loose stools. In practice, spleen qi and lung qi deficiency often occur together. The lungs, the mother, affecting the kidneys, the child. Lung qi normally descends towards the kidneys, which hold it down. Also, the lungs send fluids down to the kidneys. Thus, if lung qi is deficient, qi and fluids cannot descend to the kidneys, causing breathlessness, kidney unable to receive the qi, and dryness of the kidneys. This corresponds to the internal organ pattern of kidneys not receiving qi. The kidneys, child, affecting the lungs, mother. If kidney qi is deficient, it will fail to hold qi down. Qi will rebel upwards and obstruct the lungs, causing breathlessness. The kidneys, the mother, affecting the liver, the child. Kidney yin nourishes liver yin and liver blood. If kidney yin is deficient, liver yin or liver blood will become deficient and give rise to tinnitus, dizziness, headaches, and irritability. This particular relationship is one of the most important and common in clinical practice. The liver, child, affecting the kidneys, the mother. Liver blood nourishes and replenishes the kidney essence. If liver blood is deficient over a long period of time, it can contribute to deficiency of kidney essence, causing dizziness, tinnitus, poor bone development, and sexual weakness. In conclusion, each element can be out of balance in 4 ways. 1. It is in excess and overacts on another and along the overacting sequence. 2. It is in excess and draws excessively from its mother element. 3. It is deficient and fails to nourish its child. 4. It is deficient and is insulted by another along the insulting sequence. Thank you for your attention.